Stabilization of the anterior pelvic ring with an external fixator. The indications are unstable fractures of the anterior pelvic ring and disruption of the symphysis pubis with involvement of the posterior pelvic ring. This kind of stabilization is appropriate for emergency cases, such as multiple trauma, open wounds, and as an alternative to an internal fixation. There are two possibilities for placing the Schanz screws, in the iliac crest and the supra-acetabular region. The supra-acetabular option is more effective and is the first to be demonstrated. How the ventral connecting tubes are arranged depends on the material available, the anatomy, and the state of the injuries. Needed for this procedure are 4 5mm cell drill Schanz screws, 11 mm steel tubes of 150 and 350 mm lengths, and 1 Steinmann pin to connect the double tube constructions. Also needed are conventional adjustable clamps, open adjustable clamps, and tube-to-tube clamps for the connection of the tubes. The tube-to-tube clamps allow greater freedom of movement of the tubes. The power tool with the chuck and key and the universal chuck with T-handle are used to insert the Schanz screws. The Schanz screws must be inserted through either the short or the long drill sleeve assembly. Both the socket wrench and the combination wrench can be used to fix the clamps. The pelvis is clamped at the sacrum so that it corresponds to the intraoperative position of the patient. The anatomical landmarks for the supra-acetabular positioning of the Schanz screws are the palpable superior anterior iliac crest and the inferior anterior iliac crest, which is rarely palpable. The insertion site for the Schanz screws is 4 to 6 centimeters caudal and 3 to 4 centimeters medial of the superior anterior iliac crest, that is just distal of the inferior iliac crest. The Schanz screws are angled 10 to 20 degrees cranially and 20 to 30 degrees medially. For the technically simpler positioning of the Schanz screws in the iliac crest, the anterior edge of the superior anterior iliac spine first has to be determined. From the tubercle of the iliac border, which lies about 4 centimeters dorsal of the superior anterior iliac spine, a strong rim runs obliquely in the ventral direction. However, this direction is not suitable for the anchorage of the Schanz screws. Although it's easy to find an insertion point on the broad iliac crest, a secure hold for the Schanz screws is difficult to obtain in the thin wall of the ilium. For a better purchase, the supra-acetabular position is recommended. The supra-acetabular positioning of the Schanz screws is now shown. The ideal insertion point is located between the inferior anterior iliac spine and the ventral lip of the acetabulum. This insertion point is best found with the template, 5 centimeters caudal and 3 centimeters medial of the superior anterior iliac spine. The Schanz screw is inserted through the outer sleeve of the drill sleeve assembly. It is angled 20 to 30 degrees medially and 10 to 20 degrees cranially. The cell drill Schanz screws can be cautiously inserted with the air drive. Care is taken to ensure that there's good purchase in the bone. The final turns must be made by hand, so the air drive and the drill sleeve are removed, and the universal chuck with T-handle is mounted. In its correct position, the Schanz screw lies deep and firm in the bone. This stability allows considerable forces to be transferred in the ventral as well as in the dorsal part of the pelvic ring. The second Schanz screw is inserted just cranial and slightly lateral to the first. The tips of the screws should converge slightly towards one another. Two Schanz screws are inserted in the opposite side in the same manner. The position of the screws is checked. The insertion of the supra-acetabular Schanz screws is more demanding. However, the anchorage in the bone is better. For the ventral stabilization, two tubes are connected at an angle with the tube-to-tube clamp. Here, one short and one long tube are provided for each pair of Schanz screws. The tubes are fixed to the Schanz screws with the conventional adjustable clamps. All the nuts are tightened with the socket wrench just enough to hold the tubes in place. Now the anterior pelvic ring can be reduced. The tube-to-tube clamp and the adjustable clamps are tightened. The stabilization is completed with the second tube assembly. To improve the fixation, the tube assemblies are further stabilized with one or two cross braces, consisting of open adjustable clamps and a Steinmann pin inserted diagonally. The protruding ends of the pin are covered with protective caps. Finally, all the nuts are checked for tightness with the combination wrench. Positioning of the Schanz screws in the pelvic ring is now shown. To help determine the direction of the Schanz screws in the ilium, the inner and outer surfaces can be marked with K-wires. The first screw must be inserted through the solid iliac crest with the drill sleeve assembly. Even experienced surgeons find it difficult to place the Schanz screws in the best position, because partial perforations of the thin ilium may occur in the inner and outer walls. However, perforations are acceptable if the tip of the Schanz screw is firmly anchored in the bone. On the opposite side, the Schanz screws are inserted into the iliac crest in the same way, and the assembly is completed with two pairs of tubes. Positioning of the Schanz screws with the pelvis covered. A plastic bag is placed over the pelvis. The two landmarks, the iliac crest and the superior anterior iliac spine, are palpated. The insertion point for the supra-acetabular area is 5 to 6 millimeters caudal and 3 centimeters medial, distal to the superior anterior iliac spine. The drill sleeve assembly is inserted down to the entry point. The Schanz screw is angled 30 degrees medially and 10 degrees cranially. It's inserted in the usual manner. For the insertion in the iliac crest, 2 K-wires are placed for guidance. The Schanz screws are introduced as cautiously as possible. After the covering has been removed, the result can be checked.